Hi everyone, thanks for joining me today. My name is Reid. Today we're just going to talk a little bit about how I decided to have top surgery. Mostly we're going to talk about the process of scheduling because I've actually scheduled my top surgery. It'll be in a little over a month and I'm super excited. I will not hide this from you. I'm actually really nervous. I'm not big on medical stuff. Hospitals and definitely surgery makes me super anxious, so I'm really nervous about that, but I'm not going to talk too much about that today. I'm gonna mostly talk about like the process of actually setting up the consultation and everything. So I chose to go with Dr. Garramone down in Florida, somewhere around Fort Lauderdale, but he has the best results in my opinion. That's why I chose him. I'm going to be having double incision with him. I didn't really look too much into other doctors because I stumbled across him first when I first started looking into top surgery, and he just seemed to have the best results, and he does so many surgeries with not too many complications or anything like that. I heard that he does like 500 a year and has like 1% of people need to go back for a revision, so that's pretty good. His stuff is like cookie cutter type results, so you know what you're getting into. I really like the way he does his surgeries. Like the scars are under the pectoral muscle, so it kind of like hides it a bit, and I like that because like I'd rather not have scars, but at the same time double incision always seems to have like a better result. Because if you have like keyhole or peri or anything like that, the nipples always just look real weird. Like they're always placed funny, or they're too big or something like that. But that's enough of that. Basically, I just picked him because he has the best results. So it took a while for me to decide. It took me about 3 years of like knowing that it's a thing to get top surgery, and like now deciding and scheduling my top surgery and everything, because I wanted to be completely sure that I wouldn't be making a mistake or anything like that. But as for like the process of scheduling, I went onto their website. If you just type in Dr. Garramone, it's one of the first things to pop up. And I clicked the contact us button, and I did that on a Friday, and then their office is closed on Fridays. So they didn't get back to me that day, obviously. It's closed Friday, Saturday, and Sunday. So they contacted me on Monday, the first day that it was open since I sent it, and they scheduled the phone consultation with me, and they said that they do them on Wednesdays and Mondays, and I have Mondays off, so I scheduled it for the following Monday. So it was a week from talking to the office person to actually scheduling the phone consultation. And then I did the consultation a couple days ago, like 2 or so days ago, and I talked to Dr. Garramone and everything. But before you get the consult, before you actually do the consult, you have to send photos of your chest, so he knows what to expect, so we can look over it and like tell you what you need to know basically. So I sent those in, which is very nerve-wracking, just like sending pictures of your chest to like a random stranger basically. But so I sent those in, and then there was the top surgery consultation on the phone, and I did record that, so you're going to see that here in a minute. But I'm just going to go over a little bit about like how long things took. So they called me at about 2:30, and then I'm in Central Standard Time, and they said that they were going to do, like, I asked them when it would be, like, I asked them when the phone consultations are done during the day. They said that I would have to look anywhere between like 12 to 5 Eastern Standard Time, and they called me about 2:30. So it wasn't that bad. I was kind of expecting it to be later in their guess on when it was going to go, because I hear that from other people that he usually waits to, not the last minute, but like I'm sure he's busy, so he gets it done before he goes. But like I was expecting it to be later, not like super early or anything. When I was on the phone with him, it took about 5 minutes of me talking to him, and then I was on hold for about 15 to 20 minutes just because they're like super busy getting everybody else scheduled that is ahead of you. So, so I was on hold for about 15 to 20 minutes, and then the call itself took about 30. So it probably took another like 5 to 10 minutes to get the actual scheduling done. Okay, so here's the video now, and just stick around for the overall, like, my thoughts on how it went afterwards.
Okay to talk?
Yes, and then my sister's on the phone as well.
Hello. That's fine. Hello. All right. So let me go to your chart here. I got your photographs.
Okay, cool, because that's weird to send us.
Okay. So basically, looking at your photographs, you're not big chested, but I would still recommend the double incision method surgery, because is that what you're interested in?
Yeah, I think they have better results.
Yeah, and plus, it's really the right surgery for your chest. Your breasts are lower on your chest, and doing any other type of procedure is going to leave the chest contour looking kind of funny, and the nipples will be way too low. So the double incision method surgery is definitely the best way to go.
Okay.
Okay. Now, what I want to do is I want to ask you some questions about your past medical history, and then I'll be able to answer any questions you have about the surgery. Okay.
Okay.
Now, have you been seeing a therapist or a physician who's going to write you a letter to recommend chest surgery?
Yep, so I have a therapist that's going to.
And are you on testosterone?
No.
Do you identify with any specific gender?
Trans guy?
So is it non-binary, trans male?
Male.
Okay. Do you have family, friends, or a partner that is supportive of you having the surgery? And have you ever been diagnosed with any type of breast disease? Are you allergic to any medications? Do you take any medications currently? Do you have any past medical problems like high blood pressure, heart disease, or asthma? Have you ever been diagnosed with diabetes, thyroid problems, blood clots, or bleeding disorders? Have you ever been diagnosed with hepatitis or HIV? Have you ever had surgery before? Do you smoke? Do you drink alcohol, even socially? Do you have any family history of major medical problems? And has anybody in your family ever had a severe reaction to anesthesia? How tall are you? Do you know your current weight? All right, so the double incision method surgery, the cost of the surgery, my surgical fee is $8,000. The hospital and the anesthesia fee is $2,275, and we do this as an outpatient, so you get to go home the same day. Now, we would need a letter from a therapist or a physician that recommends surgery. Also, within 30 days of the date of surgery, you need to have a history and physical and some lab work done by your primary doctor.
Okay.
And they're gonna have to state you're medically stable for surgery. Now, most of my patients typically travel into town about a day or two before surgery. We meet in the office, we go over the surgery in detail. We do the surgery the following day. About a week after surgery, I have you follow up in the office. We'll take out the drains, take dressings off your chest. I'll teach you how to take care of your chest, and then you'll be able to go home. So patients are in town for about 8 days on average. My office staff has a pre-op packet. They're going to email it out to you today.
Okay.
It's got a checklist of everything you need to get done before surgery. They can also answer questions about scheduling, financing, things like that. I'll let you talk to them before we get off the phone. But do you have any questions for me about the surgery?
I don't think so.
Okay. All right, we'll do this. I'm going to put you on hold.
Okay.
My staff's going to pick up, and then they're going to help you out, okay?
Okay. Have a good day.
All right. It's nice talking to you.
Oh, that's gonna be annoying. It's gonna have a darker spot right behind me. Should close the door.
Thanks for holding. How can I help you?
Hi, I need to schedule a date for my top surgery.
Did you just speak to Dr. Garramone, or
I
you're
did.
just calling in?
I just spoke with him.
Okay, let me get your name. Hold on. Because I don't know because we have so many lines going. It's crazy in this office.
That's fair.
Okay. What's your name?
Reid.
Can I send you a pre-op packet via email?
Yes.
You okay with that? Okay. Let me send you that. Now, do you have any questions in regards to surgery at all? Did you want me to give you surgery dates?
Yes, I want to schedule a date.
I should find out if we can do another surgery this day. I'm at the fastest surgery center if I can have another spot. Right? Because what happens is they only let us book 2, and sometimes they let us have, 3 and 4. Depends on the. I have to ask, but right now I don't have it, so I have to ask that. That's for Friday the 13th. The pre-op on the 11th.
Friday the 13th. That's bad luck.
Then I have a pre-op on are 21, so you do not need to get a mammogram, but you're going to need to get medical clearance and lab work done 30 days or less prior to surgery.
Okay.
Medical clearance when you go get a complete physical to make sure you're healthy for surgery, and labs, you can bring it then at the orders as well with that. And it's a complete blood count panel, and it's listed of everything we need, what type of blood work we do require for surgery. We also attach in that email a medical clearance form. You can bring that to your physician, have them completely fill out our medical clearance form, and hand the prescriptions, and then they know what to do. Okay?
Okay. Okay, so the consultation, I think it actually went pretty good. The scheduler was really nice. She seemed a little like confused, or like, I'm sure she was super busy trying to get stuff done, so she was like probably a little scattered, but she was really nice. I didn't have any problems with her. And then there is when you schedule the top surgery itself, there is a $1,000 deposit that you have to put down, just so you know. And like, that all went pretty good. I don't think there's anything specifically a problem. She asked a couple questions, like you'll see that you saw that in the video, but overall she was really nice and it went well. Talking to Dr. Garramone was pretty cool. I was super excited to talk to him, but nervous at the same time, because like, for one, I don't like speaking on the phone, but overall he went pretty fast with his stuff. Like, I'm sure he's got many things to do, so he's not going to sit there and chat with like a random person who's doing a consult for. So it's pretty like fast and get it done type thing, which I was expecting. I mean, he's a doctor, he's got things to do, so I'm not worried about it. But it was actually really good. I'd recommend going with him. Obviously, I haven't had the surgery actually done yet, but if you're looking into getting top surgery, I would definitely at least look into Dr. Garramone, because he's one of the leading people in the U.S. and I think in the world. But like, he's been doing this for a very long time. He has a very large number of the surgeries a year and stuff like that. So, but yeah, so I think that's all I have to say about it. If you have any questions, put them in the comments below. I'll try to answer them for you. Have a nice day, week, month, however long until I see you again. All right, bye.